Hi, we're Team 10. Today we're going to present to you a very interesting topic, and it's about LGBTQ mental health. Consisting in our team is Jitesh, Jennifer, Marie, Rhonda, and myself, David. We have divided this topic into some categories so that we can try and give you a comprehensive overview of the mental health issues that the LGBT community face. To start with, we found it important to define the LGBT community. Who makes up this community? Is this easy to define? We then thought it would be useful to provide the class with some context of the situation with some facts about the LGBTQ community and the mental health concerns that they face. I'll be covering both these topics. Then we will go into the issues relevant to mental health of the LGBT community. This will be presented to you by Rhonda. Jitesh will then explain to you further detail about what specific mental health concerns the LGBT community face. Jennifer will provide some insight on what can be done to improve this situation, and Marie will provide some specific details on the role of the community health nurse in regards to the topic. Then she will summarize our presentation. So who is the community? The community is very diverse in its nature, as you can imagine simply by looking at the acronym. Actually, if you delve deeper, there are more letters and people that can join the community at any time. But for the sake of this presentation, we have limited it to the LGBT community, which stands for the lesbian, gay, bisexual, transgender, and queer community. It is actually quite difficult to gauge who is in the community, so I've divided it into two parts to explain it. The LGB is lesbian, gay, and bisexual individuals. These individuals identify as homosexual or open to being attracted to the same sex. I've broken it down to simpler terms in the next slide. But ultimately, to be in the LGBT community category, it is about having a sexual identity that involves being attracted to the same sex as you are, or open to it. Transgender and queer people, the TQ part of the acronym, are people who do not always identify with the gender assigned to them at birth. These people may also be gay, lesbian, bi, or questioning their sexuality, but they do not define themselves by their sexual attraction, but rather by their gender identity. As you can see, the community is very diverse, with members of the community being very different from each other. They are unified based on common experiences and with the goal of empowering their community by increasing the population. They are united primarily by the fact that they are not heterosexual and that they are a minority. These figures might slightly be out of date, but according to Gates, in 2011, 1.9% of Canadians identified as gay, lesbian, and bi, while 0.3% of the population identified as being transgender. So, just to clarify, lesbians are individuals who are female and are attracted or perceive attraction to women. Gays are men that identify as being attracted or perceive attraction to men. Bisexual people are males or females who do not determine their attraction based on gender, therefore open to relationships or sexual experience with male or females, same or opposite gender. Transgender people are people who do not identify as being the same gender as their gender assigned to them at birth. For example, someone with the assigned gender based on having male sex organs may actually identify as being female, or vice versa. Queer, also referred to as genderqueer or questioning, refers to individuals who do not identify themselves as a specific gender. They may use varying pronouns to explain themselves, or may be gender fluid or questioning their gender identity. So what are the facts and statistics? The World Health Organization removed homosexuality from its list of mental disorders as late as 1990. Despite being delisted as an official mental disorder, many cultures continue to perceive same-sex attraction as perverse and wrong. Gender identity disorder continues to be listed in the Diagnostic and Systematic Manual of Mental Disorders as a diagnostic category. LGBTQ people are almost twice as likely to experience childhood mistreatment, interpersonal violence, personal loss, or developing post-traumatic stress disorder. LGBTQ youth are 14 more times likely to commit suicide than their heterosexual peers. A study found that 77% of trans people had seriously considered suicide and 45% had attempted suicide. Trans youth were at significant risk. The study of trans people found that 20% of trans people had experienced physical or sexual assault due to being trans. The same study revealed that 34% were subjected to verbal threats or harassment. A Canadian study found that bisexuals were overrepresented in the lowest income categories in Ontario. Half of the trans people in Ontario are living on less than $15,000 a year. As I've mentioned, the LGBT community is diverse in their sexual identity and their gender. Unfortunately, what they have in common is the poor acceptance and poor mental health well-being. The Mental Health Association of Ontario outlines 3 significant determinants of positive mental health and well-being: freedom from discrimination, freedom from violence, access to economic resources. All 3 factors greatly impact LGBT community individuals and in Ontario.
Hi, this is Jitesh. Today I am going to discuss about specific mental health conditions facing the LGBTQ community. They are depression, suicide or suicidal thought, anxiety, homophobia, obsessive compulsive disorder, substance abuse, and stress. Now I am going to explain about depression. Depression can be a serious issue for anyone, but homosexual depression may be even bigger concern as gay people are at high greater risk for depression and other mental illness than general population. This increase in gay depression is not because an individual is gay, but rather because gay people live in a society that shows stigma and discrimination towards sexual minority population. Having to continually deal with the LGBT discrimination and stigma can affect mental health. Homosexual depression may also be a problem because many lesbian, gay, bisexual, and transgender people feel uncomfortable or other healthcare provider and discussing issues pertinent to homosexuality. However, the Gay and Lesbian Medical Association lists depression and anxiety among the top 10 things that gay people need to discuss with their doctors. Numerous studies have shown that lesbian, gay, and bisexual youth have a higher rate of suicide attempts than do heterosexual youth. The Suicide Prevention Resource Centers synthesized these studies and estimated that between 30 and 40% of LGBTQ youth, depending on age and sex group, have attempted suicide. It is impossible to know the exact suicide rate of LGBTQ youth because sexuality and gender minorities are often hidden and even unknown, particularly in this age group. Further research is currently being done to explain the prevalence of suicide among LGBTQ youth. LGBTQ people are more likely to use alcohol, tobacco, and other drugs than the general population, are likely to abstain, report higher rates of substance abuse problems, and are more likely to continue heavily drinking into later life. LGBTs use alcohol, tobacco, and other drugs for the same reason as others, but their likelihood for doing so is heightened by personal and cultural stress resulting from anti-gay bias, reliance on bar for socialization, stress caused by discrimination, and targeted advertising by tobacco and alcohol business in gay and lesbian publications are all believed to contribute to increased pressures on LGBT individuals to engage in substance abuse. Homophobia was coined in 1972 to describe fear and loathing of LGBT people by others. Internalized homophobia is a form of self-limiting, self-loathing, an important concept to understand in developing substance abuse service for this population. Anti-gay bias also resulting in frequent hate crimes aimed at LGBT youth, adding further to stress of homophobia and heterosexism. An assumption that heterosexism is preferred norm for everyone. Since early 1980s, AIDS phobia from both the outside of the world and as another from internalized negative self-perception causes added stress for many LGBTQ individuals. Obsessive compulsive disorder. Obsessive compulsive disorder is an anxiety disorder characterized by persistent intrusive ideas of thoughts, impulses, or images, which often result in performing compulsive rituals over and over again. Typical compulsions are washing, checking and arranging things, and counting. These actions give individuals with the OCD only temporary relief from their anxiety. With early diagnosis and right treatment, people can avoid the suffering that comes with OCD. Stress describe chronically high levels of stress faced by members of stigmatized LGBTQ groups. It may be caused by a number of factors, including poor social support and low socioeconomic status. But the most well understood causes of stress are interpersonal prejudice and discrimination. Indeed, numerous scientific studies have shown that those individuals experience a high degree of prejudice with causes stress responses, for example, high blood pressure and anxiety, that occur over time, eventually leading to poor mental health and physical health.
LGBT support groups. There is Catholic Family Service Ottawa, which they offer counseling and support services provided to children 6 to 12 and adolescents, adults, couples, and families. Next is the Centertown Community Health Center. Um, they provides a range of services for the LGBTQ communities. Centertown Community Health Center um, provides outreach, support, and counseling to the LGBT youth ages 12 to 25 years old and their families as well. Support for hormone assessment for trans youth. This is available in school. For the Centertown Community Health Center Gay Zone, they provide a wide range of programs and services for gay, bi, trans men, and other men who have sex with men. For the City of Ottawa Sexual Health Center, they offer counseling, testing, treatment, and resources related to sexual health. The Eagle Canada National Lesbian, Gay, Bisexual, and Trans Human Rights Organization, advancing equality, diversity, education, and justice. Family Service Ottawa, counseling 18 years old. Women of all ages are referred to the organization by officials working in the criminal justice system, including lawyers, medical professionals, social workers, social assistant workers, and by community-based organizations and agencies. They also provide assistance to women involved in the criminal justice system and those at risk of coming into conflict with the law. They also provide practical and effective support services for women incarcerated in provincial and federal institutions and for women in Ottawa. Last one is the Family Service Ottawa around the Rainbow community. The LGBTQ identified counselor who works with individuals and couples ages 18 and above on coming out and exploring gender identity or sexual identity and other emotional issues. For the additional organizations, there is National Alliance on Mental Illness, Depression and Bipolar Support Alliance, the Gay and Lesbian Medical Association, and the Association of Gay and Lesbian Psychiatric. What can be done to improve this? Supportive environments are key to mental health. A Canadian study found that the support from family and friends reduced stress and contributed to positive mental health in young gays, lesbians, and bisexuals. Experiencing positive responses to coming out is associated with reduced risk of substance abuse. Two studies in the US found that the 89% of lesbians and bisexual women experienced a negative reaction when they came out to their doctor. A study of medical students found that one quarter were significantly homophobic and 9% viewed homosexuality as a mental disorder.